guys, I hope you're great today. Just give it a minute or two and we'll invite some more people. We'll just wait for more people to join. I will start maybe like 1 past, 2 past. So if you just want to hang out, we will get started. I hope you're all doing wonderful today. I hope you're getting great sleep. I'm really excited to discuss this topic because I think it's a really pertinent topic to most people who suffer from sleep apnea. Okay, we'll just give it 1 more minute and wait for more people to join. And then once we've had a few more, I'll go ahead and start the discussion. Okay, I think we should get started now. So thank you everyone who has joined me again today. I do these seminars every Wednesday at 8:30 Eastern Time. So thank you so much for joining. My name is Dr. Chelsie Rohrscheib. I am a sleep specialist and neuroscientist, and I am the head sleep expert at Wesper. We are a sleep technology company, and we work with a lot of people who have sleep apnea or are trying to get diagnosed and treated for sleep apnea. I like to run these seminars because educating people about sleep disorders, especially sleep apnea, is one of my absolute passions. So I'm going to cover today's topic, which is essentially, when you're new to being diagnosed with sleep apnea and you've been placed on a CPAP, there's usually a big chunk of time in the beginning when you start using it that you'll have to troubleshoot with a lot of issues with your CPAP. It is a machine. It involves a lot of troubleshooting and technology. So I'm going to go through some of the most common problems people have with their CPAPs when they're first starting out with their treatment and what you can do about it to get the best results for your sleep apnea treatment. Okay, so the 2 things I'm going to cover specifically are CPAP troubleshooting. We're going to look at troubleshooting with your mask. We're going to look at troubleshooting with the machine itself. And we're also going to discuss how to combat some of the common side effects people experience when using their CPAP. Okay, so the first thing I want to talk about is troubleshooting the mask. So this is probably one of the most common issues that pops up the first few days or the first week that people start using their CPAP. And this is because there's a lot of masks currently available to use with the CPAP, and it can take you a while to figure out what mask is going to work best for you, and it can also take you a while to make sure that your mask fits properly. So one of the most common issues people run into with their masks is they'll get leaks of air slipping out from behind their mask. So if your mask is not fitting properly, or there's some damage, or you're having issues with the straps, air can escape through the mask. And this is problematic because when air is able to escape through the sides, you're not getting the pressures that you need to properly keep your upper airways open so that you continue breathing throughout the night. So if you go to sleep and your mask is leaking, it pretty much defeats the purpose of using your CPAP in the first place because it's not going to efficiently treat your sleep apnea. So by far, the most common reason people have air leak issues is because the mask does not fit you properly. These sleep apnea masks come in various types and various sizes. And if you have a mask that's chronically leaking, regardless of how much you tighten your straps, then it's probably too big or too small for your face. So there's 3 different types of masks that are commonly available. There's a full face mask, which covers your nose and your mouth. There's a nasal mask, which covers your nose. And there's a nasal pillow, which inserts into your nostrils. And so nasal pillows are probably the least likely to cause air leaking, but air leaking is pretty common with the full face mask and the nasal mask. So if you're finding that your mask is leaking, it's really important that you talk to your sleep technologist or your CPAP provider and see whether or not you need to adjust the size of your mask or just change the type of mask you're using completely. So that mask should fit over your face and have a nice seal and no leaks whatsoever. The other thing that can cause air leaking is damage to the mask. So things like cracks or tears. So it's important to inspect your mask periodically to make sure that it's still intact, as it may need to be replaced. Okay, let's move on to the next mask issue, which is discomfort. So masks can be uncomfortable for a variety of reasons. If they don't fit you properly, they can feel too tight or too loose. If they don't fit you properly, they can move around and cause friction on your very delicate skin. You know that the skin around your mouth and your nose is very delicate and it's more prone to damage than the rest of your body. So ensuring that that mask fits properly and is the proper size is going to alleviate some of that moving and some of that friction. The other thing is if the mask just is putting pressure on certain areas of your face, then you may want to consider switching the type of mask you use. Like I said, there's 3 different types of masks, 3 different categories, but then they also have subcategories. So there's dozens and dozens of different types of masks that you can try. And sometimes it just involves a lot of trial and error before you come to a mask that works appropriately for you and doesn't cause any pain. I have a question. Have you ever tried a full face overnight? I have tried it on myself with the machine on. I did not sleep overnight with it because I don't have sleep apnea, but I do know how it feels against your face, and I do know how it feels to have the pressurized air going into your mouth and lungs. So, while I did not have to experience the discomfort of trying to sleep with a full face mask, I have relaxed while awake and used it to give myself some indication of what my clients and my users are going through. So it's no secret that using a CPAP for the first few weeks is quite uncomfortable. This is why CPAP has a very low compliance rate of only around 40%, which in the medical world is quite low. But we do know in research from clinical studies that if you can generally get past that 2-week mark of using it consistently, your chances of using it and being able to sleep efficiently while using it go up tenfold. So it's really about making sure you're comfortable in those first few weeks until you can get over that initial hump. And then hopefully within a month or 2, you're going to be using it consistently, and at some point you're going to get so used to it and feel so good because your sleep apnea is treated that you won't be able to sleep without it. So that's the goal. Okay. Other things that can cause mask discomfort is just having it on your face too tight or not using a mask that's appropriate for you. So many people will try using a nasal mask even though they breathe through their mouth or their mouth slips open when they sleep. Nasal masks are only appropriate for nasal breathers. So if you do tend to breathe through your mouth or if your mouth opens at night, then it's not going to work efficiently and it can cause you some discomfort. One last thing, what's your thoughts on the F20 full face? It depends. So the way I feel about different masks is it's very dependent on the individual. So some individuals get on just amazingly with some masks and others absolutely hate them. So like I said, it's not really about a specific mask being better than another. It's more about trial and error to try a bunch of different masks until you find one that works appropriately for you without causing discomfort and also alleviates your sleep apnea symptoms. Okay, let's move on to machine troubleshooting. So, like I said, mask issues are usually the most typical, especially when you start using your machine. But you may experience some machine issues early on as well, or much later. So let's talk about some of the more common issues that occur with the CPAP machine itself. So the first one is you may complain that your CPAP machine is too loud. Now, most new technology, most new CPAP machines are very quiet, especially compared to the old generation CPAP machines that used to be quite loud. The technology has come so far within the last decade or even the last 5 years, and they're meant to run pretty quietly. This means less disturbance to you and also less disturbance to your partner. Now, that's not to say they don't still make noise, because they do, but it's a lot more manageable than how they used to be. Now, if you go to sleep one night and your CPAP machine suddenly sounds very loud, there's a few reasons why that could be happening. The first is almost always because there's an air leak somewhere, whether that's from your mask itself, from the tubing, or from the machine itself. So if your machine suddenly starts getting very loud, you should go through the entire machine all the way up to the mask, and look for places the air might be leaking, because once that air leaks out, it's going to cause a huge increase of sound. It's not super uncommon for hoses to get, areas of damage or leaks. And a lot of times the sound is coming from the hose. So hoses move around a lot at night. They get bent, they get slept on. That can cause a lot of damage compared to the other areas of the machine. So go through, turn your machine on, and check for leaks. If your hose is broken, then it's best to replace it. Going back to the mask issue, if it's due to your mask, then it's best to try another mask so that you get a proper seal over your nose or mouth. If it's coming out of the machine, if there's a leak somewhere in the machine, then you're going to have to talk to your manufacturer and look into whether that's something you can get fixed or replaced. Another reason your machine might suddenly get loud is because your filters are clogged. So all CPAP machines have filters that you're supposed to change out, usually monthly, sometimes more often than that. And these keep particles and dust and other things from getting into your lungs and making you quite sick. If you change out your filters regularly, then it shouldn't be an issue. But if you miss a change out of those filters, then those filters can get really clogged up, and that can increase the noise of your machine. So always check your filters and make sure you're changing them out consistently according to, how the manufacturer tells you how often you need to change those filters out. Okay. All right. So that was loud. Oh, and I just realized I almost skipped right over water. So let's get to that one. So number 2 for machine issues is water buildup, whether that's in your mask, in your tube, or on your mask or on your tubing. And this typically occurs due to condensation. So your mask and internal tubing is generally warmer than your environment. So the inside of the tubing and the inside of the mask is always going to be warmer than your bedroom is. When your bedroom is quite cool compared to the inside of your tubing and your mask, that causes condensation to build up on the inside and the outside. And what this can cause is water vapor dripping on your face or on your skin, or it can, get into your mouth if it builds up in the mask. And that's very unpleasant, and people generally don't want to feel like they're trying to breathe through water. So the way to reduce that condensation is to try to equalize the temperature between the inside of your tubing and your mask to your bedroom environment. And there's a few ways you can do this. Obviously, the easiest way to equalize that temperature is simply by increasing the temperature of your bedroom. So if you typically sleep very cold, say in the low to mid 60s, you may want to consider increasing your temperature so you're closer to the 70s. Another easy way to increase the temperature on the outside of your tubing if you don't want to increase the temperature of your bedroom, is by running your hose under your blanket. So that way your body heat is going to increase the temperature on the outside of the hose, and it's going to be a little bit more equal to the inside, and that condensation won't occur. Now, most new age machines have heated tubes, and this keeps that condensation from happening. So if you have a relatively new machine and you're still getting water buildup in your mask and in your tubing, there may be an issue with that heating mechanism, and you may want to get that checked by the manufacturer. If you have an older machine, then it's less likely that your machine has the heating capability. There are adapters, so you can get heated tubing for some older machines, but if you're unable to get that, heated tubing, you may want to consider upgrading your machine to a newer version. And it's, upgrading your machine is not just going to be better for reducing condensation, but it's also going to have a lot of other benefits, such as, being quieter and just more efficient than the older machines. Okay. The next machine issue that is pretty typical is hose tangles. So it's super common for when you're laying in bed, you flop around at night, as most people do. You might not even be aware that you're moving while you sleep, and your hose can get tangled up. Now, this can happen where your hose either gets tangled up with your pillow or other things in your bed, or you can accidentally roll over on your hose and block your hose. Obviously, that's problematic, because if your hose gets tangled or blocked, then you're not going to get the air pressure that you require to keep your airways open. So there's a few things you can do to prevent your hose from getting tangled up. The first thing you could do is opt for an over-the-head tubing system and mask. So there's two types of tubing placement that connects to your mask. So there's the traditional tubing connection, which connects to your mask, and then it runs along your body. That traditional setting is going to result in you being more likely to roll over on the tube or move the tube and get it tangled up. However, there's another type which actually is meant to go over your head. So it attaches to your mask and it goes up over your head. This tubing system is easier to organize. You can put it up over your bed, and that completely eliminates the possibility of your tubing getting tangled or putting kinks in your tube or breaking your tube. So that's one option. So if you don't have that type of mask and tubing set up already, and you find that you're consistently getting tangles, then you may want to talk to your CPAP provider about maybe trying, the over-the-head tubing system. Another option is to use a CPAP pillow. So there are pillows currently available on market, actually dozens of them by various companies, that are made to position your CPAP and your tubing in a comfortable position, so it's less likely to get tangled up. Oftentimes these pillows have special grooves for your head and neck, and special grooves that your hose and tubing can run along so it doesn't get tangled up. They're relatively cheap. They're not super expensive. The other benefit of these pillows is that they often allow you to sleep in multiple positions, so you can sleep comfortably on not only your back, but on your side as well. Okay. I have a question. Does changing the humidity level on the machine help reduce condensation? Yes, to an extent. So obviously, if you're putting more moisture into your tubing itself, it's going to be more likely that that moisture builds up if there's condensation. So if the outside air is cooler than the inside of the tube, that water's going to collect on the outside of the tube. With that said, most people really like a higher humidity setting when they're using their machine, because it keeps the airways nice and moist, and it doesn't make them feel like their mouth is getting very dry. So like I said, the easiest option is just to either increase the temperature of your room or running your tubing under a blanket so it doesn't get super cold. Yes, you can try adjusting the humidity. That's perfectly fine, but also be aware that if you adjust your humidity down quite low, it might result in some discomfort. Okay. All right, so we've talked about mask issues, machine issues. Let's move on to side effects. So it's very common, almost to the point of being normal, for people just starting out with their CPAP to experience a certain amount of side effects. And so I'm going to go through some of the more common side effects that people would typically experience within the first week to a month of using their CPAP. So the first one and the most obvious one, and I'm sure all of you have already experienced this, is trouble sleeping. And this makes sense, right? Because humans evolved to be very driven by consistency. You know, our brain likes consistency. We like being in the same kind of conditions when we sleep. We like going to bed around the same time. And when we change things dramatically in our environment or about our behaviors, it becomes very difficult for us to relax and nod off. And when you add all the tubing and the masks and the sound of the machine and the feeling of the pressurized air entering, you know, your upper airways, that makes it very difficult to relax. So there's a few techniques that I always recommend every person starting out on CPAP does and follows. So the very first thing I always recommend before even getting into bed and trying to sleep with your CPAP is put the CPAP on your face and start using it during the day while you're awake. So when you get your CPAP home, fill up your water tank with distilled water, turn it on, put on your mask, adjust the straps, and allow yourself to sit and relax for like an hour or two. Make sure you're not doing anything important, and just allow your body to adjust to the feeling of having the mask on your face and the feeling of pressurized air entering your upper airways. The other thing is to breathe deeper than you normally would. So normally, you know, we breathe pretty shallow. We don't really take these big breaths, and we don't really fill our lungs completely. But in order to get your lungs used to this high pressure, you need to be able to expand them completely. Allow your lungs to feel what it's like to have air, you know, basically forced in, because that's what a CPAP is doing. So sit, breathe deeply until you can't expand your lungs anymore. Maybe hold it for a few seconds and then slowly breathe out. So you're really going to pay attention to how it feels to breathe that pressurized air in, and you're also going to really pay attention to how it feels to breathe that pressurized air out. And while you're doing this, you can do relaxing activities like watching TV or reading, something to kind of take your mind off a little bit about the stress and, you know, sometimes the claustrophobia of wearing the mask and feeling the air. And so try to do this daily for the first week that you have your CPAP, and do this before you even, you know, go to bed. Now, when you go to bed and you actually start using your CPAP, first make sure that you're in a really calm and relaxed place before you even put it on, because the last thing you want to do is be stressed out and worried and then put the mask on and then have the pressurized air entering your lungs, which is going to make things even worse. So try to do relaxing activities for about 30 minutes before you go to bed, so that when you are in bed and are ready to put your CPAP on, you're in a very relaxed state. Try, if you can't initially fall asleep, which, let's be honest, most people who are just newly starting on their CPAP are not going to be able to, try to do some of those relaxation activities that you did while you were awake and using your CPAP. So deep breathing exercises, really focusing. You can try meditating, which is really helpful for getting your brain off the feeling of the CPAP. You can do something like listen to relaxing music or listening to a podcast to kind of take your mind off of it. And it's really important to go easy on yourself. Do not expect that you're going to sleep perfectly or be able to sleep at all the first few nights you use your CPAP. Remember, the goal isn't to be perfect automatically and have your sleep apnea corrected immediately. The goal is to slowly adjust to the point of where you're comfortable enough to use it nightly. So generally, sleep technicians will tell you that you need to use your CPAP at least 4 hours per night. This is true, but if you find that, you know, you've used it for an hour and you can't fall to sleep immediately, that's okay. You can take off your mask the first night as long as you used it a little bit. The other thing is that's really important is almost all machines have a ramp button on them. And when you push that button, the pressure of the CPAP is going to go way, way, way down to a really manageable level. and then it's going to slowly build up to the pressure that you need to keep your airways open. You are allowed to press that ramp button and use it as often as you need to until you fall asleep. So if you press the ramp button and it gets to a high pressure and you still haven't fallen asleep, feel free to press that button again. So remember, it's a slow process. It's going to take you a while to get used to. Don't feel guilty, but keep with it, because we know from clinical research studies that people who can hang on for 2 weeks to a month usually end up being very successful with their CPAP treatment. Okay. All right. We just discussed not being able to fall asleep, which is the most common. Let's talk about some other common side effects. So the next one is going to be skin irritation, specifically from the mask. So the mask is on your face. It's a foreign material that you're not used to wearing, and it can cause you some irritation. So we kind of discussed some reasons why a mask can cause irritation. Poor fit is obviously going to rub against your skin and cause a lot of irritation. But another thing people don't consider is contact allergies. So a small percentage of individuals might go on to develop an allergy to the mask itself. Now, older masks were oftentimes made of latex, which is an allergen. A lot of people are allergic to latex. These newer masks are mostly made of silicone, which isn't nearly as inflammatory as latex, but it's just something to keep an eye on. So if you're getting a rash that doesn't go away after a few hours of, when you wake up, or you're getting hives or blisters, then it's very likely an allergy, and you should talk to your provider about getting on a different type of mask. Another issue is if you don't clean your mask consistently enough, and you're realistically supposed to clean your mask every single day, you can get a buildup of dirt and other irritants that can cause a lot of skin issues and irritation. So if you're seeing a lot of irritation, the first thing you should do is assess as to whether you might have an allergy to your mask. And the next thing you should do is assess whether, your mask cleanliness is an issue. And of course, never ever clean your mask with harsh chemicals, because that can cause a reaction. Always use something gentle like dish soap and wash it thoroughly after you've used it. Okay. Number 3 is going to be sleeping position. So most of us have a preferred sleeping position, but we also move around a lot at night. So we might start out in one position, but oftentimes it's completely normal for us to flip over onto our side or our stomach. And this can cause a lot of issues for people who are newly starting with CPAP, because our tendency is to not stay on our back all night. And obviously the most comfortable and optimal position for a CPAP user is going to be on their back. Now, you really can't roll on your stomach when you use a sleep app. That's the unfortunate truth. So if you're a stomach sleeper, there's not much I can help you with there. However, I can give you some tips to actually being able to sleep soundly on your side. So the first thing is, if you use a nasal pillow or a nasal mask, it's going to be a lot easier for you to sleep on your side than somebody with a full face mask. This is also true if you use the over-the-head tubing that I discussed earlier. If you don't use a nasal pillow or a nasal mask, and you don't use the over-the-head tubing, another option is to get one of those CPAP pillows. Again, we're going back to the CPAP pillow, because those CPAP pillows can be specifically made for people who only sleep on their side. So they're made with indents that are specifically made to elevate the head slightly so your mask doesn't rub. And there's also an indent for the tubing if your tube runs along your body and not over your head. So if you're finding it super difficult to sleep on your back, look into one of these pillows, purchase it, and give it a try and see if that improves your sleeping position. I was told by my sleep specialist that you should definitely not sleep on your back if you can help it. That is true for some people. So about 50% of people with sleep apnea have positional sleep apnea. And generally that means that they only have sleep apnea symptoms on their back. And this makes sense, right? Because when you're laying on your back, gravity is able to pull all of the tissues and obstructions in your throat backwards and make them more likely to collapse and cause the obstructions that lead to, you stop breathing. So it's very common for sleep specialists to tell those individuals who have severe sleep apnea when they're on their back to only sleep on their sides. And while this is true, generally speaking, a CPAP should correct your breathing regardless of what position you're in. So even if you have positional apnea, your CPAP should stop you from having your apneas even on your back. Now, in an ideal world, somebody with positional sleep apnea would have their CPAP going and sleep on their side to make absolute 100% sure that their sleep apnea is completely, reduced down to a normal level. But that's not realistic for everyone. So yes, generally speaking, sleeping on your side is healthier for breathing, but not always. Some people also have severe sleep apnea on their side, so it's really dependent on the individual. How to prevent the mask from leaving lines on your face. So it's tricky, especially if you have a full face mask. It's very typical to get lines where the mask connects with the face. There are masks that are made specifically to alleviate pressure spots, so they redistribute the pressure more evenly around your face. On other issues is the straps themselves might be too tight, so you might need to adjust the straps, ensuring that you're not getting any air leaks, of course, or have your technician adjust it for you. The other issues, of course, would be that you might try a different mask altogether. If you're a candidate for a nasal pillow or a nasal mask, you may try that instead. But remember, it's usually a mask fit issue that's going to cause the irritation. So sometimes you just have to try multiple masks before you come to one that's not going to leave big marks and discomfort on your face. Okay, let's move on to the next side effect, dry mouth and lips. So this one's super common. And we try to alleviate all the issues with dry mouth by including the humidifier on the machine. And the humidifier usually does a pretty good job, but not always. One of the most common reasons people wake up with a really dry mouth is because their mouth opens while they're sleeping. So especially if you have a nasal mask or a nasal pillow, if your mouth opens while you're sleeping, air is going to rush out of your mouth, and it's going to dry out your throat, your mouth, and your lips. So that's by far the most common reason. So the absolute first thing you should do is discuss with your sleep technician about whether you should change to a full face mask that will deliver moist air over both your mouth and your nose, and it will help reduce some of that dryness. The other alternative is you can try to use something like mouth tape or a chin strap when you're sleeping. And this will keep your mouth from sagging open while you're sleeping. So even if you think you're a nasal breather, if you're still experiencing a dry mouth and dry lips, there's a chance that your mouth is probably open quite a bit during the night. So you can try that. Of course, that's only if you can breathe exclusively through your nose. If you cannot breathe exclusively through your nose, then you absolutely should have a full face mask. So other things that could help with the dry mouth, dry nose is you can use dry mouth solution. So there's specialized solution for people who have a chronic dry mouth that they kind of swish around in their nose and throat. You can also use petroleum jelly on your lips. So I always recommend petroleum jelly, also known as Vaseline, on the lips because it's thicker and it stays on better than things like chapstick or lotion. So try to avoid chapstick and lotion because they wear off quickly. Use a good helping of petroleum jelly instead. Okay, and then finally, we have nasal congestion, and this is a huge one, obviously, because our nose is very finicky, especially if you have a very nasal passageway and you're prone to things like allergies or polyps, or if you have a deviated septum. It can be very typical for somebody who is using a CPAP to experience even worse congestion of their nasal passage. Now, the first thing you should do is obviously speak to your doctor and investigate whether there's a medical reason you're having nasal congestion. If it is allergies, obviously you would go on, antihistamines or specialized nasal sprays to reduce those allergies. If it's something blocking your nasal passage, like polyps, for instance, or a deviated septum, or turbinates, for instance, that may need to be corrected by surgery. If it's a chronic enough issue that it's causing you problems, then surgery may be your only option. Other things you can do is saline rinses with a neti pot. So that's the thing you put in your nose and kind of let go into your sinuses and drain out. Various types of nasal sprays, and also nasal dilators can also help. So these are little plugs that you can put in your nose, or little nose strips. The plugs are fine for people who are using nasal masks and full face masks. Obviously, they're not going to work if you use a nasal pillow, but you could still use the nasal strips. So it's really important just to make sure that it's not an underlying medical condition, because nasal breathing is healthier than mouth breathing. So regardless of whether or not you use a CPAP, you should be able to breathe through your nose anyway. Okay, well, I think that is the end of my summary of this topic. So just to kind of remind everybody what we discussed today, we troubleshooted our CPAP use for the first few weeks. So these are things that people commonly run into when they're first starting out. And we also troubleshooted some side effects. So now that I've finished, I'm happy to take any questions you have or comments. Feel free to ask questions below. It doesn't have to be related to this topic. It can be any sleep questions at all. I'm happy to answer. So I'll give people a few minutes to ask questions. And if nobody has questions, that's fine. I'll be back next week at the same time. So look out for our next topic, and I hope to see you then. Thank you. Very informative. Oh, great. I'm really glad that that was helpful for you, Candace. I think one of the issues with sleep medicine these days is, we get our sleep study, we get diagnosed with sleep apnea, you'll get a prescription for a CPAP, but you don't really get that much help getting used to the CPAP and troubleshooting it for the first few weeks. And I'm very passionate about giving people the information that they need so that they can get over that initial 2-week to 1-month hump and, go on to successfully use their machine. So if you are having problems, there's tons of resources online. I'm always happy to chat with you. If you want to shoot me a message on Facebook, I'm happy to answer your questions at any time. Okay, well, thank you so much. Great information. Thank you for joining. Really appreciate it. Yeah, I hope it was helpful for you. And I really do wish everyone really good luck with their CPAP journey. When I say I understand how difficult it is to get used to CPAP, I really understand. I've been working with people who have been struggling to use their CPAPs for years. It is one of the harder medical technologies to get used to. So I really empathize, and, hopefully with a lot of support, you can get through this journey. Okay, we've got a question. I've had a CPAP for over 10 years and finally found a specialist that ordered a different type of mask. That's great. I'm honestly shocked and appalled that your specialist wasn't more accommodating to you way sooner, because there's dozens of masks, and it's pretty well known in sleep medicine that people often need to try multiple masks before they get to one that is successful for them. So that's a good example of how sometimes you really have to advocate for yourself. And if your doctor's not listening to you, get a second opinion, or just keep badgering them until they finally give in. I know some doctors are really hard to communicate with. Trust me, I've worked with a lot of them. But it's really important to stand up for yourself, and of course embrace the community around you. So Facebook groups or other groups on the internet, so that you can get an idea of what steps you should take to actually, go get a better mask or go get a better machine. Okay, guys, I'm going to let you go for tonight. Thank you so much again for joining me. Look out for my next topic. We'll post that soon. And like I said, I'll be back at the same time next week, so 8:30 Wednesday Eastern time. And if you're interested in Wesper or testing your sleep, check out our website. Or if you want updates, follow the link in the description of the seminar, and we'll be happy to send you automatic updates. All right, take care, guys.